My name's Naomi Byron. I'm a Unison rep and also a member of Unison's National Executive Council. However, I'm speaking today in a personal capacity to oppose the introduction of mandatory vaccinations in the NHS on the 1st of April. The government argues that this measure is about protecting public health. I believe that's not true, and if implemented, it will do huge harm to public health, to patient safety, and to the future of our NHS. Now, personally, I believe in the vaccination programme. I'm fully vaccinated. I believe it's safe to take for the vast majority of people. And I believe that the wider the vaccination spreads, the safer we are, and the more it protects everybody against COVID, because if you're vaccinated, you're less likely to catch it and pass it on. You're also, in most cases, much more protected against severe disease, including hospitalisation. But I also believe that we all have a right to choose what to put into our bodies, and the threat of dismissing staff if they don't take it is an authoritarian reaction, and it's counterproductive. I believe that more people would end up taking the vaccine if we continued the positive education programme about the benefits of the vaccine and encourage people. I also believe that this measure is being introduced by a government that is bent on the breakup and privatisation of the NHS. For example, at the same time they're putting this in, they're also passing the Health and Care Bill through Parliament, which aims to entrench privatisation and aims also to help with the breakup of the NHS, including potentially the breakup of national pay bargaining. I don't think we can believe the Tory government when they say that mandatory vaccination will protect public health. I believe that this is one of a series of measures where they're setting the NHS up to fail in order to hand some of it over to private companies. Now, the NHS is already chronically understaffed with around 100,000 vacancies. These levels of understaffing are affecting patient care, and they're creating chronic exhaustion among many staff that are in the NHS. A Unison survey at the end of last year said 2/3 of staff who responded were thinking about leaving the NHS. The top reason they gave was the effect that their work was having on their mental health. We have, in October, we had 6 million people, almost 1 in 10 of the population, on waiting lists in England, and it keeps increasing because of the crisis in the NHS. There is a Lords committee that looked into mandatory vaccinations and estimated that on top of the 100,000 vacancies we already have, then 126,000 staff could leave the NHS or be dismissed because of the introduction of mandatory vaccinations. They also estimated that it would cost £270 million to recruit and train replacements for those staff. I ask you, given the situation the NHS is in, can we afford that? I say the answer is no. Also, if you look at the care sector, where this was introduced in the autumn, the CQC is now warning of a serious and deteriorating situation around recruitment and staff retention. From April, the vacancy rate in the care sector went up from 6% to 11.5% at the end of December. It nearly doubled during the time when mandatory vaccination was introduced. Now, I welcome all the calls to postpone the deadline of the 1st of April for mandatory vaccination in the NHS. However, I don't believe that this goes far enough. I believe that every single union, every NHS community campaign should be calling strongly for this law to be scrapped entirely. Not only to protect the NHS, but also to protect the public sector and jobs in all kinds of other sectors where, if this is introduced for us, it will be introduced for you as well. I appeal to you to join a campaign to save our NHS. If you're not already a member of a union, join a union and get active, and help us campaign for the NHS to be properly funded to provide patient care, to fill all the vacancies, not sack more staff, to bring all outsourced staff back in-house on NHS paying conditions. Solidarity.